Have you guys heard of PCOS? This actually stands for polycystic ovarian syndrome. So basically what this is, it is a hormonal condition that affects like women, usually around the reproductive age and a little bit younger, but usually between like the teens, so 16 to about 30 is when this kind of is prevalent, and when you start noticing some changes. I myself was diagnosed with PCOS when I was about 21, 22 years old. I was getting irregular periods. I was having weight issues, gaining a lot of weight, especially after starting birth control pills right after getting married. Along with, there's acne, there's cysts on your ovaries, there's hormonal issues, metabolic issues. And I also was diagnosed with insulin resistance, and that is also something that comes along with PCOS. Along with all these things, it is honestly one of those issues that a lot of East Indian and Asian women have. And we don't talk about it. Not many of us even get diagnosed with it. We just have to deal with all these symptoms. And we're wondering, excess weight. We're wondering what the mood swings are. We're wondering what the pains are, especially when it comes around that time of the month, your period menstruation. They are very heavy. You're getting the excessive cramping. Some of us are even diagnosed with endometriosis, which is obviously the thickening of the lining inside the uterus, which causes a lot of cramps. So all of these are very, very, or they're connected to this PCOS diagnosis. And a lot of times doctors are not even aware. Luckily my OBGYN, back when I was diagnosed, was on it. She was testing my labs and everything was checked out, and she pretty much diagnosed me pretty quickly. And so I just wanted to go over, give you guys some additional information, being a registered nurse and having this diagnosis, what I did to help reduce the symptoms, but also help me live a balanced life. And so yeah, I just wanted to share with you guys a few different things with this PCOS diagnosis, what we can do, diet, exercise, and all of that good stuff. I will share with you guys what worked for me, what didn't work for me. So I'm going to be having like many different, let's say, episodes. Basically, I'll be going through maybe a symptom at a time and what helped that symptom. But overall, all in all, PCOS, if you were just recently diagnosed or if you know somebody that has PCOS, initially, like I said, it is hard to kind of wrap your head around what it is, what's going on, but let me be the one to guide you guys through. I've been dealing with it for 20 years. I was diagnosed at 22-ish. And so, yes, do the math. I am 42. But like I said, 20 years of experience, what worked, what didn't work. I will guide you guys through, okay? And as having a background in nursing, being a registered nurse, understanding how the body works, and it's definitely helpful. But I do want to say, before starting anything, any kind of supplements, any kind of diet, exercise program, do consult with your physician, because you guys may be on certain medications, you guys may have certain restrictions that need to be approved prior. So making sure that you guys are getting that approval, okay? So yeah, let's kind of sum it up here. It is a immuno disorder kind of situation where you are kind of born with it, but certain things will exacerbate, meaning make things worse. So a lot of things will make your symptoms worsen, and then certain things will make it better. So if you know somebody, or you yourself are diagnosed with PCOS, or you suspect that you're, have something along these lines, again, it is like a lot of us are dealing with it, but not necessarily diagnosed. So pay close attention to all these signs and symptoms that I've been mentioning and talking. And if you feel like you may be in that kind of a spectrum, I would definitely talk to your guys' doctor about it and get tested, and we'll go from there, okay? All right, guys. Well, I hope you guys enjoyed a little bit of information on PCOS, and stay tuned for a lot of other great information, tips, and advice on how to deal with PCOS. And hopefully you guys will get some education and enjoy what I bring to you guys. All right, guys, stay kind and beautiful.